plenty of volunteers only join hand.
Funding for COVID-19 preparedness will come into light in the supplementary budget expected this week in Parliament. Prime Minister James Marape stating the supplementary budget will see the cancellation of key government programs expected to run this year, including the National Population Census. Yesterday, the Prime Minister was questioned if the government was looking to development partners for COVID-19 loans. Mr. Marape responded that it is still in discussion with Cabinet and the country will learn of funding avenues once Parliament resumes.
And I will allow for Cabinet to make that decision in our Wednesday Cabinet on this matter. So, but we've got positive indication of support from World Bank, ADB, our Australian partners, New Zealanders. In fact, New Zealand High Commissioner has texted me. They're sending in $3 million worth of help. So it's a family of bilaterals and multilateral partners who are willing to help us. We'll combine them all into a formal cabinet paper on Wednesday to announce exactly what level of support we're receiving from all organizations, including World Bank. So,
Prime Minister Marape stating that if anything, COVID-19 has shown how weak and underfunded our health system are and the need for the setup of essential isolation ward facilities in each province.
We are learning from this experience and we will build a better system of healthcare delivery for our people, including, as I indicated 2 days ago, ensuring our health workers, ensuring our policemen, and ensuring our frontline defenders of our country, including our military, going on into the future.
But state-owned entities are stepping in to assist where they can. Kumu Petroleum Holdings presenting a cheque of 1 million kina to Puma Energy for fuel supply to police across the country. KPHL also in a media statement confirming the release of 5 million kina to the government out from the committed 100 million kina dividends paid forward to the government.
We needed a lot of stuff, and one of the things that we needed was fuel. And I rang the State Enterprises Minister who then went around and asked companies if they could supply us with fuel, and we are so thankful and honored that some of the companies came back in with a check for us to continue our services to our people in the country.
To date, since the beginning of PNG preparedness to COVID-19, a 3 million kina internal fund by the National Department of Health was used to have airports, medical checkpoints set up, a call center set up within NDOH, and the setup of 8 beds at Port Moresby General Hospital. That was over the period of January 27th to March 20th when the first imported case was confirmed and the government had no choice but to move operations out of the National Department of Health to Morata House. Today, the National Command Centre has every needed agency in walking distance of each other.
We just want to thank everyone for their cooperation. There have been some challenges, there have been some issues with movements and understanding and information, especially as to how the SOE is being delivered in the provinces, especially. We will work through those minor challenges and make sure that if we are to live with the COVID-19 in the next 6 to 9 months, it'll be done in a more structured and a more effective way.
But questions of funding are still high on the agenda. So far, UNICEF has donated 500 sets of personal protective equipment, or commonly known as PPEs, to NDOH. These 500 sets, EMTV understands, includes 500 face shields, 1,500 gowns, 1,000 heavy-duty rubber gloves, 20,000 surgical gloves, 5,000 surgical masks, and 10,000 surgical caps. The 500 sets unrealistically will not be able to cope with COVID-19 outbreak by WHO standards, as each component of the PPE are expected to be disposed of after usage. UNICEF and UN also assisting the government in setting up testing facilities and procuring of tents to be used as screening facilities for hospitals nationwide. NDOH and WHO conducting training for 25 frontline workers.
I said, what happens if we come out of the 14-day period, if there is no coronavirus? Can we be relaxed about this one? Mila country, harem good. You look in USA, you look in Italy, you see many countries around the world who said got effective system of policing borders as well as effective healthcare system. Because of complacency and border blow, he exposed, and one person infect him. There's a statistics of one person can infect him 3. And if that statistics multiplies, you can have almost 5,000 to 6,000 persons infected as a result of one person in our country. That is the reason why we went on emergency and high alert and shut down for us to take stock of where we are. And we will not be relaxing after the 14-day SOE period is lifted.
For the PNG government, funding in the millions will be needed before we even start the race to get PPEs, testing kits, isolation wards, and health officers trained for an outbreak. How and when we have the funding at hand to prepare will come into light on Thursday when Parliament is recalled. Adelaide Sirks Kari, National, EMTV News.